I'm actually home today, so
Oh,
I'm doing the show remotely from home in good old Cranberry Township on a beautiful sunny day. Um, but what we're talking about today is screens and testing and how they give you your best outcomes. And we're going to travel across a lot of different roads today that we've never traveled across before. Um, for a couple of reasons, which will play out as we have our show today. One of the reasons is why I'm home today and why screens and testing has been important for me personally, which I'll share with the listeners in a little bit. But first things first, I just want to say I'm dedicating today's show to my Aunt Carol that passed away recently.
oh,
My Aunt Carol passed away on May 30th at the age of 89. My Aunt Carol was one of our biggest fans, Scott. She listened in every month for the last 10 years, and she would post comments on the Facebook page, and she would watch us do our goofy things that we do. But unfortunately, she passed away a couple weeks ago, so we're missing one of our biggest fans today, Scott, watching on Facebook, but I know she's watching us down from heaven and supporting us still all the same.
we're thinking of you, Carol. Wow, wow. Good. Thanks for sharing that, and we're thinking of you too,
So,
though.
yeah, so, and that's going to lead me into, what something we talk about a lot, and, why Aunt Carol passed away was due to a fall. So we talk about a lot with my balance program and my falls and screening and testing and what the value of it is. 1/3 of the people of the age of 65 fall every year. One half of the people of the age of 80 fall every year, and over 41,000 people die each year as a result of their fall. Usually, it's not directly the fall itself, but complications from the fall, and that's exactly what happened to my Aunt Carol. My Aunt Carol had a fall, an accidental fall, and she broke her hip. She had a hip fracture, and then from that hip fracture, she had to have a total hip replacement, and that total hip replacement didn't stick. It kept coming out, and so they decided they should do another surgery to revise it. And it was during that surgery that she passed away. So, about 30% of people will die from complications from their hip fracture. So it's something that we take very seriously at MRS Physical Therapy. We talk a lot about. Unfortunately, this is what happened to my Aunt Carol from a fall that she had. It led to her death from complications from that fall, and that happens to a lot of people. And that's something I try to educate people with a lot, and the importance of getting fall risk screens. As you age, your balance changes, whether you realize it or not. A lot of people don't realize their balance has changed. Sometimes it's a spouse that notices their balance is a little bit off, and maybe you start thinking about a cane. And honestly, I get so many people that come in and say, "Please don't put me on a cane. Please don't put me on a walker." But my goal and my job is to test your balance and see if we can fix your balance, number one. And if we can't fix it 100%, then we'll make recommendations for maybe a cane or a walker if that's necessary. But our number one goal is to make you safe so you don't fall into these categorical statistical probability of falling, which unfortunately leads to a lot of deaths annually. So at MRS Physical Therapy, we have a very strong balance program. And part of that balance program is you coming in and getting screened and tested. And many people have come in and they've taken advantage of our free balance and fall screens, which just takes about 15 minutes for you to do. Just like you go to your doctor, your primary care doctor, they run some tests, and then they give you the results of those tests and see, okay, well, are you healthy or are you not healthy? Do we need to make a change in your plan, or you do status quo? We do the same thing with our fall screens. Is you come in and we do a couple simple tests with you, and sometimes you get the green light and we say, yeah, no, you're doing good, keep doing everything you're doing. Or maybe we get a yellow light, like a caution light, and say, well, you're doing pretty good, but we're going to advise you a couple additional things for you to do. Or we might give you a red light, which means, you really need to consider some therapy to help out with your balance. Now, the good news is a red light does not mean stop. A red light doesn't mean, don't do anything. This is the way it is. The red light means, we can do some things to help you out to get your balance better and doing better and, have a successful outcome. But the first step is to take that, you take those tests and do those screens. And the only way we can do that is you come see us at MRS Physical Therapy.
So it can be preventative, something like a fall. It doesn't have to be just an accident. We can find ways to, you can prevent that from happening.
It's very preventative. And part of our balance program is education to make sure that your home environment is safe. And so we have, checklists of things you can take home with you and look around your home and see if, see if you're safe in your home environment, if not leaving things on the floor, throw rugs, things on the stairs, clutter around, things that you can fall over, trip over, and cause events and accidents. That's a simple thing you can take home and do on your own after you take our screening test and you do our balance testing. But yeah, our balance testing is, we've been doing it for a long time. We're experts in it. We're able to identify someone why they're having their balance issues. So usually your balance is a component of three different things: your eyes, what you see, what your visual intake is, your ears, which is your vestibular system, and your proprioception, how your body has an awareness of where it is in space, especially in your lower body and your feet. And so our testing helps to look at each one of those factors and figure out, if it's one of those factors, if it's multifactorial, which often it is. And, believe it or not, we can work on all three of those things, whether it's your eyes, your vestibular system, and your proprioception. Those things all get weaker as we age, and we can strengthen each and every one of those things to get you out of the fall risk category. So many times people will come into my clinic and they'll get a score that puts them in the fall risk category. And through our balance program, within a month or a couple months' time, they are no longer a fall risk. And that's our best outcome. That's what we're looking for everybody, whether you live in the Beaver County or Butler County area. We've got clinics that are close and convenient for you to come see us. We take all insurances. Many times you don't even need a doctor's referral to come see us. If you just want to do the fall risk screen, you don't need a doctor's referral at all. Just come in and do the free screen. It won't even cost you anything. Just call us up and give us your name and your telephone number, and we'll get you an assigned day and time that you can come in for that free fall risk.
So what does a fall risk screen entail? When I'm in your office in MRS Physical Therapy, what are some of the tests I'll be doing?
Yeah, that's a great question. So first of all, I'm going to watch how you walk. So myself or one of my other therapists, we've got a couple other therapists that do the screens along with me. We're going to watch how you walk and see if there's anything that jumps out at our trained eye. As physical therapists, we're trained to watch people and watch their mechanics and how they move. We're movement specialists in that way, where we can watch someone walking down the street and get a pretty good idea if they're a fall risk, or maybe even a diagnosis that we see, or if how we call it their gait. Their gait is how they walk. So that's the first thing we do when they come in. We'll do a short little interview with them just to see if they have a history of falls, because having a history of falls is an indicator, obviously, of being a fall risk, number one. And then we'll do a couple tests. One of the tests we do is a timed up and go test. So we time you from sitting, you stand up, you walk 3 meters, you turn around, and you come back and sit down again. So that test alone gathers a lot of information. So that test alone tells us how you do just getting up out of a chair. It tells us how you do walking for a short distance. It tells us how you do turning in space without holding on to something. And it tells us how you go from a stand to sit position. So that timed up and go test, it takes usually anywhere from 10 to 20 seconds to do the test, depending on your abilities. It's a very quick and efficient way for us to measure whether you're a fall risk or not. We also measure your time of doing that, and also we time you for 10 meters. So time you for 10 meters or about 30 feet and see how long it takes you to walk 30 feet. The great thing about these tests is there's been a lot of scientific research and data to show, what the normal numbers are. So we have normal numbers for your age, and we can compare that to how you do and tell you if you fall within or out of the normal range for those tests. And then a third big test is a sit-to-stand test. And I've demonstrated this in the clinic before, where you sit and you cross your arms across your shoulders and you stand up and sit down as many times as you can in 30 seconds. And Scott, you've performed that test with us on the radio show in the past.
Yes.
And what I do is I count the number of times you can stand up and sit back down from a normal chair without using your arms. And that puts you in a category of, within normal limits or outside normal limits. And so it's really a combination of all these tests that we put together to decide whether you are a fall risk or you're not a fall risk. Another really good one is balancing on one foot. Your ability to balance on one foot without holding on. You should be able to balance on one foot for at least 10 seconds. If you are not able to balance on one foot if you can't balance on one foot for 10 seconds without holding on to something, you are a fall risk. It's as simple as that. And, why do I have to balance on one foot? Well, you have to balance on one foot when you go up and down stairs, when you go up and down a curb. There are regular everyday activities that you're balancing on one foot without even thinking about it. So all these tests are functional tests because they're measuring functional things you do every day. And the great thing is at MRS Physical Therapy, we have statistical normative data that will tell us if you're within normal limits or you're outside the normal limits and whether you're a fall risk. So these are great, very simple tests that we can do for you and advise you from those tests, from those simple screens. Like I said, these simple screens are going to give you your best outcomes in life. So best outcomes in life, meaning not falling, not having issues walking, being safe in your environment. But you really need to be doing these simple screens in order to get those best outcomes.
From the results you get from the test, now what would you recommend someone do then? Like you said, a lot of people say, "Oh, I don't want to use a cane," but are there other options, or how do you take the results and then put them into practical use?
Absolutely. If you have a little bit of a fall risk and I feel like you're safe in your environment, I'm not going to advise you to start with a cane or a walker. I'm going to advise you to start with our balance program. Now, the screen, like I said, it's a really quick snapshot of your abilities. The screen would lead, if you are a fall risk, the screen would lead to a full physical therapy evaluation. The full physical therapy evaluation is going to look at everything. It's very comprehensive. In addition to those 4 or 5 tests that I just talked about, we're going to additionally look at your flexibility. Flexibility in your ankles changes as you age. So increasing tightness in your ankles, that can lead to balance changes. People that say they start to feel like they're falling backwards, a lot of times it's as simple as they've lost some flexibility in their ankles, and that's starting to push them backwards when they start to walk. We're going to look at your strength of your whole musculoskeletal system, your upper body, your lower body, your core. Sometimes it's strength issues. If you have difficulty getting up out of a chair without holding on, then it's likely you have lost strength in your glute muscles or your buttocks. Your quad muscles in front of the legs. Those 2 key muscle groups get weaker as we age if we don't keep regular activity, and then you start to notice it functionally by your inability to get up out of a chair. And so we're going to be testing those specific muscle groups to see if they've been weakened, and then give you exercises accordingly to strengthen the muscles that have gotten weak, to improve the flexibility of the areas that have gotten tight. And then also there's very specific balance exercises as part of our balance program that we do as well. Things with your eyes open versus your eyes closed. Standing on a firm surface like the floor or standing on a pillow or a soft mat helps to improve your balance. Standing and walking, with one foot in front of the other. Standing with your feet together, eyes open with your eyes closed. There's a whole series of balance exercises that we provide for our patients to help them to improve their balance in all situations that they'll be coming across, whether it's their home environment, their outside environment, walking across an uneven surface on the sidewalk or the parking lot, or walking across the grassy surface if they're doing lawn care or garden care and things like that. We're going to make sure whatever your personal goals are, that we will address them for you so you are no longer a fall risk and that you're safe in your environment, whatever that happens to be.
We're talking to Dale Reckless from MRS Physical Therapy. Dale, I'm going to take a commercial break. We'll come back with more, so you all stay there.
Join Beaver County Radio's Scott Tady and Curtis Walsh on Saturday, June the 20th for a special broadcast from 10 a.m. to 12 noon at the Harmony Township 250 celebration being held on the historic Logstown and Legionville site along Duss Avenue. The world-famous Beaver County Radio prize van will be there with the Beaver County Radio birthday prize wheel. Scott and Curtis will have prizes from the Pennsylvania Lottery, Pirate and Zoo tickets, along with Fun for All and the all-new Beaver County Radio t-shirts. Beaver County Radio's live broadcast at the Harmony Township 250 celebration is being brought to you by Harmony Township and Beaver County Radio.
Summer is here, and that means you definitely don't want your cooling system to let you down. If you need help with your HVAC unit, call McGee Heating and Air Conditioning and you'll see just how efficient a company can be. McGee has been a respected name since 1965, and that represents a lot of satisfied customers. Family owned and family operated. You can trust them. Everyone at McGee extends best wishes to the Pennsylvania All-Stars team in the Penn Ohio Football Classic. McGee Heating and Air Conditioning, Main Street, Aliquippa.
One of the greatest honors a person can receive is to be gathered with their people at the time of their passing. Even biblical authors, when they wanted to explain what it meant to have lived a great, prosperous, and meaningful life, spoke of the individual as having lived a long time and being gathered with friends and relatives near as they closed out their twilight years. Being gathered together with loved ones is something that the J&J Spratt Funeral Home takes very seriously as well. The comfort both given and received cannot be underestimated. J&J Spratt Funeral Home also knows that the honor shown to a loved one at their time of need in this manner is still the right thing to do today. J&J Spratt Funeral Home has been gathering together with area families for 4 generations and looks forward to honoring future residents deserving of being gathered together with friends and family. Click jjsprattfh.com.
Have you recently had surgery or an injury that requires physical therapy? Or maybe you just need a partner in wellness. NovaCare Rehabilitation has got you covered. With 6 convenient local locations, there's bound to be a NovaCare Rehabilitation near you. NovaCare Rehabilitation is part of the largest physical therapy network in the U.S. with over 2,000 outpatient facilities and over 7,000 licensed therapists. NovaCare Rehabilitation has convenient early morning and evening hours and offer aqua therapy at the Rochester and Moon Township locations. Schedule your appointment today by going to www.novacare.com.
Are you frustrated by high copays for your generic drugs? Stop overpaying and start saving. Discover Forward RX, your local cost plus pharmacy in New Brighton. At Forward RX, we believe in transparency and affordability. No insurance middlemen, no inflated prices, just the true cost of your medication plus a simple fixed markup. Join the Forward RX family today and experience the difference. Check out our medication prices online at fwdrx.com or give us a call for a price quote. Forward RX. Come for the savings and stay for the service.
Put freedom in your future. Freedom United Federal Credit Union in Rochester.
Scott Tady here, joined on the phone by Dale Reckless of MRS Physical Therapy. We're talking about today the importance of health screenings, and Dale was illustrating that with some examples from his life. So, Dale, we'll back out to you. How you doing?
Yeah, good. So, I'm dedicating today's show to my Aunt Carol that unfortunately passed away on May 30th at the age of 89. She was a regular listener of the show, which is interesting. She married a Beaver Falls guy and raised her 3 kids, not in Pittsburgh, but out in Philadelphia. And so she lived out in Philadelphia, and she would tune in to WBVP and listen to the show every month for the last 10 years. She would watch on Facebook Live, which was a great thing that was added into the radio show that you guys have. So it's been really appreciated that people can watch and listen from anywhere in the world to your station. And, my Aunt Carol, I know she really appreciated it. She wouldn't miss a show. She would tune in. She would leave, encouraging comments, for every show and say, hey, Dale, this is great. I really enjoyed listening to, this part of your talk and things like that. She was a very sweet and kind lady. She was very musically gifted, played the piano and loved sports, loved to talk about sports. And, we're going to miss her, and I'm going to miss her personally and as well as someone that listened to me every month and was very encouraging for me. And unfortunately, she passed away from a fall. And that's something I talk about a lot, is the importance of getting screens to make sure that you're not a fall risk. Because, there's 41,000 people that die every year from falls. 1/3 of the people over the age of 65 that fall every year, and 1/2 of the people over the age of 80 fall every year. And unfortunately, 30% of these falls lead to fractures, and from the hip fracture complications lead to death, which happened in my Aunt Carol's case here. So, really, today's show is dedicated to her, and doing some public service announcements really for the importance of seeing your doctor, getting screens, coming to MRS Physical Therapy, getting fall risk screens and things like that. Also, I had another friend pass away last week. He passed away of throat cancer. He passed away at the age of 52 from throat cancer. And that cancer was caught by a dentist, which I think often happens with throat cancers. Is often it's a dentist that catches that. Sometimes your primary care doctor can. But again, today's show I'm really dedicating to the importance of screening and seeing your primary care doctor and seeing your dentist. And as I was thinking about today's show, I have a lot of patients that come in and they don't have a primary care doctor, or they don't have a regular dentist that they see. And it's so important that you have that healthcare team of a primary care doctor and a dentist and a physical therapist to help you do screens, do testing so you get your best outcomes. Because if you're skipping those appointments, then things will not get caught when they could be caught and save your life, to be honest. Whether it's your dentist that's seeing things in your mouth, your primary care doctor that's doing regular blood work. We complain about healthcare so much, and I understand it because the healthcare costs are so crazy and the hoops you have to jump through can be really crazy sometimes to get the testing that you need. But it's so important that you get your regular checkups from your primary care doctor. You see your dentist on a regular basis. And for our case, you see your physical therapist on a regular basis to do the fall risk screens to make sure you're not a fall risk. So really, today is a strong public service announcement to the listeners in Beaver and Butler County. Again, if you want the fall risk screen, we'll do free fall risk screens for you. If you want to come to our office in Beaver County, that is MRS Physical Therapy. We are in Bridgewater, right in the heart of Bridgewater in Stone Point Landing. That's the old Keystone Bread building. The number to call us there is 724-728-7550. And then we have Cranberry Physical Therapy in Cranberry on Route 19, right next to the, I'll call it former North Park Lounge, as it's now called Sensi's, as Sensi's bought it. But we're right next to the former North Park Lounge on Route 19 in Cranberry Township. So we have great close access to both people in Beaver and Butler County. And honestly, we've got people that come from, all over to see us. We've got people that travel, 40, 50 minutes away to come see us for our specialized care that we provide. The Cranberry office number is 724-591-8121. So either of those offices are very accessible for everybody to come. There's, it's free parking. It's very accessible, easy to get to us. It's handicap accessible, both offices, obviously. If you ever want to shoot me an email, you can also use that, which is d.reckless@mrsphysicaltherapy.com. I'm happy to answer any questions through email, or if you just want to call. And, we've had listeners in the past that have, called me up and say, hey, Dale, this is what's going on. What do you think? And I talked them through it, and they, sure enough, they came down for a screen, and that screen led to some what I believe to be valuable therapy and input that I was able to provide to them to help them out with, their journey in life here. So, please take advantage of these opportunities, whether it's your primary care doctor, your dentist, your MRS physical therapist. We're here to help you out, but we can't help you out if you're just sitting in your house at home and you're not taking active care of your own life.
You mentioned the dental screenings. Every time I get a checkup, the dentist, they'll do the test with your tongue, lift up your tongue, and they look under it, and it takes seconds. It's a matter of seconds, but it's so important what they could find. Yeah,
it can save your life. Like I said, my friend Mark, he had throat cancer diagnosed a couple of years ago, and he had treatment for it, and he did well, but then unfortunately it came back, and he passed from that just recently at the young age of 52. Cancer doesn't care your age in many cases. I've treated many cancer teenagers and, all the way on the way up. But there are, valuable tools and screens that you can do to prevent this, and that'll be my next lead-in, Scott, if we have a couple minutes. I'm going to talk about myself and why I'm broadcasting from home today. I was actually diagnosed with prostate cancer a couple of years ago. And prostate cancer is very common for men. They say most men will get prostate cancer at some point in their life. But again, most men will die with prostate cancer than from prostate cancer. Now, that being said, it's the number 2 killer of men as far as cancers go. Lung cancer is number 1. Prostate cancer is number 2 as far as cancers that kill men. So it's serious, although it's very treatable, and has very successful outcomes. It's very treatable. But guess what you have to do in order to get treated? You have to get tested. And so I did my regular doctor's appointments, and I got tested for it. And they call it a PSA level. It's a simple blood test that just popped up, and in 2022, mine started to rise. And, they put you in what's called active surveillance, which means they just keep an eye on it. And they just keep an eye on it because it's a commonly very slow growing cancer that many times you don't need treatment at all for it. Well, for my case, unfortunately, it did start to progress. They recommended some further treatment. So last Friday, I had my prostate taken out, and my doctor expects very successful outcomes for me based on the fact that I had my screening and testing done at an early time. So that's taking care of it. So, I got the cancer out, and, hopefully things will continue to go well for me in that way. But again, if I had not gotten the testing done, that cancer would have continued to grow and possibly, gotten out of the prostate and moved to other parts of my body. And then, your outcomes are not as good at that point in time. So that's why it's so important to do, see your primary care doctor, get your regular blood tests, get the testing that you need by, your primary care doctor, your dentist. And, we've talked about the physical therapy part and the value of not being, because we're talking about a lot of the aging population here, the importance of, seeing your physical therapist to do your balance screen so you don't, become a fall risk. These things all have such great value, but you got to take that step to go see your doctor, your dentist, your physical therapist. Otherwise, we can't help you out. The only way we can help you out is if you come sit in front of us and we can talk to you and, we'll be able to give you your best outcome if we're able to do those screening tests for you.
I got to ask how you're feeling. How you feeling? You said you had the prostate out Friday.
Yes. Prostate cancer is an interesting thing. I never felt sick. I felt great. I felt like there was nothing wrong with me. I never had any issues at all. There was no change in my lifestyle that led me to believe I should be concerned. The only thing that came up is when I did my regular appointments with the doctor, I had this irregular blood work. And this irregular blood work, leads them to do other testing and say, okay, well, this is what's going on. But I had no physical ailment at all, which is scary in one way if you think about it, because there's people walking around. The only time they go to the doctor is if they're in pain or they're hurting or something like that, or they have a serious injury. Otherwise, they're like, I feel pretty good. I don't need to see the doctor. And that's the wrong mindset, because there's so many things that could be going on inside your body that are not symptomatic yet. And if you wait till they are symptomatic, then it's too late at that point in time. So you really need to be going to your doctor on a regular basis to catch things before they become symptomatic. I mean, I felt great before my surgery. I don't feel bad now. I'm recovering. I'll be off for a little bit because I have to rest my body. But I expect 100% return to all my normal activity within a week or two, because I took the proper tests. I got the proper screens done. I took care of myself. And I want everybody that's listening to take that step. If you're listening, you're like, you know what? I haven't seen my doctor for a couple of years. I should probably see my doctor. And actually, honestly, it was over COVID that I had not seen my doctor for a couple of years. And when I went back to see the doctor after COVID had cleared, that's when they caught the rise and everything. So I got kind of lucky that I went right back to the doctor as soon as things opened up again. But if you're one of those people that's at home thinking, I haven't seen the dentist for a while, I haven't seen my primary care doctor for a couple of years, you got to take that step, make that phone call, get into your primary care doctor. It's really simple testing. It's not comprehensive. It's just simple blood work that you get done that can help you out. Simple physical examination. In the case of a physical therapist, it's a simple 15-minute balanced fall risk screen that can help you identify if it's something you need to take seriously, or if you're on the right path and you're doing well with your current programming. So,
now that's interesting. I mentioned in the case of prostate, because as someone who's had a colonoscopy, you kind of think, okay, I passed that with flying colors. Now I don't have to worry about this for 10 years. But you found out because of a blood test.
That's right. Yeah, colonoscopies are another thing that you should get. It's one of those tests that no one likes to think about. It's actually the procedure is super simple. The recovery is super simple. It's to prep for colonoscopies that are the worst, right?
Yep.
And most doctors will recommend you start doing those at a certain age. But I've seen a lot of people with colon cancer. That seems to be something on the rise too. But again, it's very preventable if you get your regular testing done, and you get the procedure done. And that's the reason why the healthcare system is doing these tests and these treatments, because we know if we catch early enough, we can prevent issues in the future. And all these things, usually things, it depends if you have a family history or not. If for prostate cancer, if you're high risk, meaning you have a parent or a sibling that's had prostate cancer, they start recommending at the age of 40 or 45. Some doctors won't start testing for it till 50 or 55. So definitely in that 40 plus range. If you have a history, 50 plus range. If you're just in the aging process, they're recommending you start to do this testing. There's very successful outcomes. You just got to get the screens and the testing done to get those best outcomes. But you're right. The colonoscopy, that's another direction of things. That's a component, and that it's not related to the prostate part of things. It's an additional thing that testing has to be done and taken care of. But every one of us wants to live a long and healthy life, right? So a long, healthy life really starts with proper screenings and testing that you get on a regular basis.
You mentioned,
and again, I'm just thinking about my patients that come in and say, who's your primary care doctor? Well, I don't have one. I haven't seen a primary care doctor in 10 years. Or, who's your dentist? I don't see a dentist.
Yeah. That's
so,
not.
Really, today's topic is public service announcement, which has the same abbreviation, the PSA, has the same abbreviations as the PSA testing. which is a prostate-specific antigen test that you get when you do blood work. And it's just a simple blood test they add into the rest of your blood work. Typically, when you have a certain age, for getting testing and making sure that you're not going down a path of possible issues, and that you take care of things before they become a problem. And
a blood test is fairly simple, and they've gotten so efficient at it. You actually schedule your time ahead of time. You can go as early as sometimes 7 a.m. The one I go to in Vanport, across from the McDonald's there, and you're in and you're out, and they're very professional. It's not a laborious process, and it's so important.
No, I've always had very easy access to blood work as well. Like you said, when you get your blood diagnostics done, you schedule online or their app ahead of time. They give you 15-minute windows or whatever it is, and you're in and out. I mean, I usually schedule it during my lunchtime at work, and I'm in back to my lunch, and I still have a half-hour lunch to spare.
Right.
So, but you have to get that blood work ordered from your primary care doctor, typically. And then the primary care doctor is going to have to read the results and give you the outcomes of the results. So, and I know a lot of the healthcare apps are really efficient now. You'll get your blood work and you can see the results before your doctor does. And I'll do this. I'll look on my app, and my app will tell me, it'll show me my historical trends. How things trended over the years, and all the different values and whether they're high or low or within normal limits. And then I have a phone call sometimes, or a personal visit with the primary care doctor, and say, this is low, but that's normal. It's not a big deal. Or this is high, and that's not a big deal. And obviously within normal limits, that's not a big deal. Or, in my case, my PSA levels started to, fluctuate and go up above the normative numbers, and said, okay, well, now you got to go see a urologist and let's see what they have to say. And you can go down that track. And for me, it was about a 4-year process of starting to see a change to when I actually had to do something about it. That's how prostate cancer is. Many guys don't need to ever have any kind of changes in their lifestyle or do anything. And interesting with prostate cancer, there's really nothing I could have done differently to prevent it. People always ask me that with their diagnosis, because a good example is all the work I do with vestibular rehab. I do a lot with people that get dizzy. And people ask me, well, what did I do wrong? What can I do different so this doesn't come back? Because it can be really debilitating. And honestly, many times there's not a specific answer to that, because it was part of the aging process of something that happened to you. The good news is, for vestibular rehab as an example, we can fix it, we can help it. But just regular, good, healthy eating and regular hydration and regular normal activity is the best thing you can do, but it's not going to guarantee it doesn't return again. I have about 5 or 10% of my patients that return back to me, once a year for their vestibular issues, but, we fix it again and they're on their way. The other 80, 90% I never have to see again because we fixed it for good. But that's just kind of the way it goes for them. Once we fix it, it doesn't come back, and that's great. I love that. But these regular screenings are so important, because you have to nip things in the bud before they become a problem. You have to get your regular blood work and colonoscopies and all that stuff before it becomes a problem. And once it becomes cancerous and gets outside of the area, then you're dealing with chemotherapy and radiation therapy and all the things that go along with that, and the negative side effects from that, which can be a long road ahead. And I know many people that go through that, and I pray for those people every day, because that's a tough outcome as well. But the best outcome you're going to get is if you get these early screens and you get this regular testing with your primary care doctor, your regular dental visits, your regular visits to a physical therapist to take care of your musculoskeletal system. I see a lot of people with shoulder pain that they think it's just going to go away over time, and it does. These things, they don't go away on their own. And that's when you need to come see me, so I can take care of it to get it better, so you get back to your normal lifestyle again. There's no reason for you to be going through your daily activities in pain, limiting or compromising what you want to do because of your pain, or stopping your activities that you want to do because your balance is off and you're afraid you're going to fall. All these things, MRS Physical Therapy has been geared towards helping you out as an individual to get better, get stronger, get safer. And then obviously, in combination with MRS Physical Therapy, seeing your primary care doctor for regular visits, seeing your dentist for regular visits, to take care of you for those other valuable things for your overall good health.
So I can think of people I know who they walk with a limp and they'll say, oh, it's my knee, it's been acting up for years, or they'll have a funny hunch in their back, and then same thing, oh, it's been that way for years, and you kind of wonder why don't you address it? Why don't you try to do something about it? I mean, no one wants surgery, but if there's a way you don't have to limp the rest of your life, wouldn't you follow that?
Well, I think that's a good point, because I think a lot of it is directed by fear of what might happen if they go see somebody. Number one, if you go see somebody, you're getting medical information that you can do whatever you want with. There's no surgeon that's going to say, you need surgery and, strap you down and do surgery. It's a decision that's still on you if you want to do that or not. In fact, a lot of ortho doctors that I work with, if I see someone that probably needs a knee replacement or a hip replacement, the doctor always leaves it up to the patient to say, now's the time. The doctor is there to give you the information. You know what? I did an X-ray, I did an MRI, and you need a hip replacement. But you're going to tell me when that time is based on what how far you want to go and your limitations before you need that. And I know some people that say, I'm not ready for it yet. I'm going to wait. And then they finally get to the time where the pain gets so bad or their activity level is so limited, or now's the time to get my knee replacement or my hip replaced. That's very common with orthopedics. So it should never be a fear of getting more information. There's nothing ever wrong with getting more information to go down the path of, okay, now I have that information, and now I'm going to decide, what my outcome's going to be. Am I going to wait for the surgery, or am I going to get the surgery? Am I going to go try physical therapy first, because we know that physical therapy first before surgery has great outcomes? You might not ever need surgery, or physical therapy might be able to put off your surgery for another 5 years, which is great as well, especially for someone that's in the middle age, someone that's in the 40s, 50s, or 60s that really needs a knee replacement or hip replacement. If we can put that off for you with physical therapy, our treatments, so you don't need the surgery, that's your best outcomes too, because we know that the components of the hip replacement or the knee replacement only last so long. So, for example, if you're a 55-year-old or 60-year-old individual that needs a knee replacement or a hip replacement, and we can put that off to 65 or 70 years with our physical therapy program, then you might only need one knee replacement or one hip replacement. You won't ever need it to be revised or replaced again. Someone that needs a hip replacement or knee replacement in their 40s or 50s is a good chance they're going to have to get that hardware redone in their lifetime. So if we can put that off a little bit longer through our physical therapy program, that's really your best outcome. But I agree, Scott. A lot of people have fear of information, I guess. I don't know why, because it's not forcing you to do anything, but that fear of information is preventing them to get the information they need to make informative decision. And that informative decision is what we all really should have. An informative decision is my balance off? Okay, well, am I going to do the physical therapy, or am I not going to do the physical therapy? Do I need a knee replacement? Well, am I going to try physical therapy first and see if I can put that off for some years? Same thing with hip replacement. Do I wake up in the morning with dizziness? I sit at the bed, I feel good after a minute, and then I'm okay. But it happens every day. Is that something I'm going to go see Dale at Emrys Physical Therapy about and get rid of it, or am I going to deal with it and take the risk of falling and leading to other complications? So, Emrys Physical Therapy has so many great opportunities for helping people out that are in pain or discomfort before it becomes more of a problem. And that's really our goal. And my goal is, with the public service announcement radio show today, is to encourage people to take that step to see your primary care doctor, see your dentist, see your physical therapist, so we can prevent things before they become more problematic and really get in the way of the lifestyle that you want to lead as you age.
Absolutely. Now, with technology, we see people with smartwatches, and it'll tell you your current blood pressure. It'll show you if there's a spike in your blood level or whatever. Are there any practical uses so far for screening, or is that just a glimpse of information that does it help in any way, or do we still need to go to the doctor, still need to go to the dentist, still need to go to a physical therapist?
Well, those numbers are just numbers unless you have someone that's professional that knows how to read those numbers and tell you what they mean, right?
Right.
So the smartwatches are great for information. Technology is great for information. And you know what? With AI, maybe that's something that's coming in the future, and it probably is, to be honest, where AI is going to start giving you more results of the data. So all you have on your smartwatch is data. All you have in your smartwatch is data. You don't have interpretation of that data. But my guess is in the future, healthcare is going to move to more AI and give you more interpretations of that data and what it means and what you should do about it. There are certain tests that I don't know. At some point, maybe they can figure out ways to test things without blood work. But right now, you got to get that blood drawn to tell you what that is.
Mm-hmm.
There's certainly tests, and I do this as part of my radio show all the time. I have people watching on Facebook Live like they're doing today, and watch the simple test that I do. And you can do that test at home, and I can tell you if you're within normal limits or outside of normal limits. But then that's not comprehensive. That's just a simple 1 or 2 step test that tells us a little bit of information, but it doesn't give us the full picture. So in order to get the full picture for anything, I think you really need to be going to your primary care doctor, your dentist, your physical therapist to get the full picture. Otherwise, you just have one piece of data that you may or may not, there's a lot of data out there that there's a lot of what we call false positives. So false positives are pieces of information that looks like it might lead to something, but it's really not an accurate measure of the whole picture. You really have to get that whole picture to identify, what's going on with your body. Your body is so complex, from what your heart does, what your lungs do, what your GI system does, what your brain does, what your inner ear system does, what your musculoskeletal system does. Because it's so complicated, that's why we have so many specialists. Your primary care physician is a general doctor that knows a little bit about a lot of things, but they're going to be the first person if you have, inner ear issues to send you to an ENT. If you have orthopedic issues, they're going to send you to an orthopedic specialist. If you have neurological issues like Parkinson's or multiple sclerosis, they're going to send you to a neurologist because the body is so complex. You need to go down those specific paths because there's so many intricacies of each one of these diagnoses that, we need to know what's going on to help you out. And the great thing about MRS Physical Therapy is that we have special physical therapists that specialize in orthopedics and neurological diagnosis, like MS and Parkinson's, orthopedic diagnosis like frozen shoulder, low back pain, neurological specialists that look at vestibular rehab, specialists that look at your TMJ, your jaw. We hit all those areas at MRS Physical Therapy. We're very comprehensive as a physical therapy clinic so that we can address whatever ailment that your doctor is telling you to have, whether it's your primary care doctor, saying you have fall issues, go see MRS Physical Therapy. Your neurologist saying you have Parkinson's, go see MRS Physical Therapy. Your orthodontist or dentist saying you have TMJ issues, go see MRS Physical Therapy. We've made these connections and we've trained our staff to be able to treat a very comprehensive body through your system, whether it's neurological, orthopedic, vestibular, whatever it is. MRS Physical Therapy can take care of all those things for you. So that's why I really encourage you to reach out to us at one of our clinics. Again, the clinic MRS Physical Therapy in Bridgewater, that number is 724-728-7550. Or our clinic in Cranberry, that's on Route 19 next to former North Park Lounge, now called Sensi's. That number is 724-591-8121. And whether you have a doctor's script, we'd be happy to help you. If you don't have a doctor's script, we have something called direct access, which means you can come to see us without seeing the doctor first. And we see all ages, and we take all insurances. So we really do not want any people in our community to have a barrier to come see us. We're going to take care of you, whatever it is. That's always been my goal as a physical therapist. I've been practicing for 37 years now, which every time I say it, wow, that's a big number, right? But I've been around doing this for a long time, as have my other colleagues. They're all very experienced in treating all diagnoses and treating all ages. We'd love to help you out. Don't hesitate to give us a call if you want to come down for a free screen, or if you have a script from your doctor and you need to get this taken care of. Don't wait. Get it taken care of sooner than later is always your best outcome as well.
So I'm thinking you were like Doogie Howser. You were doing this when you were like 14 years old.
God, I'd love to think that. Mm-hmm.
Talking to Dale. Well, Dale, thank you for sharing these personal examples. The theme today has been screenings, the importance of health screenings. Are there any other ones or anything else on the topic of screenings you want to touch upon?
No, I think, the value of screenings is taking that first step and making that phone call. If you do not have a primary care doctor, there's so many primary care doctors in our area. We are so lucky in Pittsburgh. We are in an area that has healthcare out the wazoo. We have, two major players. We have, maybe more than two. I say we have, three major players in the Pittsburgh area as far as healthcare industries. you're likely to have an insurance that requires you to choose one. Again, the great thing about MRS physical therapy is it doesn't matter what your insurance is. But some of your insurance might require you to go to one of your healthcare providers within the system. That's fine. There's so many in the Beaver County area. There's so many in the Butler County area. There's so many fantastic primary care physicians around. There's so many fantastic dentists. We are so fortunate to be in the Pittsburgh area. There is absolutely no reason for you as an individual not to be able to find someone that you like. So maybe you have a primary care doctor you had a bad experience with and you didn't like him. Find someone else. That's fine. That's not a big deal. Find someone that you connect with. Find someone that you're on the same page with. But there are so many great primary care doctors, dentists, orthodontics in the Pittsburgh area for you to take advantage of. There's absolutely no reason why you can't find someone that you like and you connect with. Maybe you connect with a guy, maybe you connect with a woman. That's okay too. There's tons of options there. But find someone that you connect with, that you're going to get into a regular relationship with, that you can see on a regular basis. Usually it's once a year. Sometimes if you have something actively going on, they might want to see it twice a year. That's fine too. But they're the drivers of your care, your primary care doctor. They're the ones that have the fingertip on your health and help you find the people that you need to get you better and to keep you well and lead a healthy lifestyle.
Dale, we appreciate your life-saving advice. We are glad you're feeling better after your procedure. I'd like to think Aunt Carol enjoyed this episode.
Thank you. I appreciate that, Scott.
All right, Dale. Looking forward to having you in the studio again sometime soon. So you take care. MRS Physical Therapy, people. Dale, you take care. Talk to you soon.
Okay, bye-bye.
All right, bye. We got a couple commercials to get to, and then Frank Sparks stepping in at 10 o'clock. If you missed any of this and you want to be like, oh, Dale said something, I want to go back and what did he say? Good news. It's on our Facebook page and our YouTube pages. So just go to type in Beaver County Radio on YouTube or Facebook, and you can catch up with that and bring you up to date. So